Hi, Blue Mamas. Thanks for being here with us. We're continuing our expert panel with St. Luke's Health Professionals, and today we have a pediatrician and internationally certified, board-certified lactation consultant. I want to introduce to you Dr. Heather Winesett.
Hi, thanks for having me today.
Yeah, thanks for being here. We have a lot of new moms here tonight, new and expecting maybe first time mamas. So I'll let you introduce yourself and tell the moms what you can help them with, what you can treat, and what kind of patients you can see.
Yeah. So I've been in Duluth for probably about the last 14 or 15 years. I moved here from Utah where I completed my residency in pediatrics. I have 4 kids myself. My oldest is almost 20 and my youngest is 11. And along the way, during all of that, I got really interested in breastfeeding medicine. And so I'm also a internationally board certified lactation consultant. So that's a big part of my practice too. I think all the pediatricians in our practice see kids all the way from birth up until at least 18. A lot of the times I actually follow kids even into their early 20s just because when they're in college, they may just need me once or twice a year, but they don't necessarily need a new adult doctor at that point.
Mm-hmm. Yeah. Great. I know when I delivered my daughter, and this was 5.5 years ago already, I wasn't familiar with any of the pediatricians or any of the different routes that I was able to go with finding a provider for her. So I just kept seeing the doctor who was on call that day, the pediatrician who was on call that day that checked her out. And it ended up being a really great fit for us. But do you have any advice or tips or any direction you can give moms to setting up a primary care doctor for their little ones?
Yeah, I think that's a great question. I think at both hospitals in town right now, there are pediatric hospitalists most of the time who will end up seeing your baby while you're in the hospital, but none of those people will follow you as an outpatient. Their job is just in the hospital setting. Okay. So you'll probably need to find some sort of doctor for your baby. Pediatricians are one option. There are family practice doctors too, and some people prefer that option. I think probably the best thing to do is to really kind of ask some of your friends just who they see and kind of what they've liked and disliked, just to get an idea of who's out there and who might be a good fit for you. Mm-hmm. I think the other thing I'd say is that if you come to the office and you see a person and you're not 100% sure if that was the right fit for you, it's totally okay to try out another provider or two in that office and really find somebody that you feel comfortable with so that you can ask questions and feel like you're being heard and getting the answers that you need.
Yeah, that's a great reminder, because sometimes I know, like, it happens with a lot of people that we see for appointments in our lives that we feel bad or feel like we're hurting feelings if we switch. So it's great to hear that coming from a pediatrician to, find care that does fit your family and that you feel comfortable with.
Yeah.
Yeah, that's great. Do you want to talk a little bit about lactation consulting and breastfeeding?
Yeah, well, I think in general in Duluth, we live in a pretty awesome city for breastfeeding, at least as far as the support that both hospitals give. Both hospitals are baby friendly, which means that they adhere to the highest standards of best practices for breastfeeding in the hospital setting and beyond. I think I can speak more about the St. Luke's program because I'm obviously more familiar with that one. St. Luke's has a fabulous service called Aftercare, which is staffed by lactation consultants, and they're available most days of the week throughout the year. And they are able to provide any sort of breastfeeding advice or answer questions from birth until you wean at whatever age that is. And then in our office, I'm a internationally board certified lactation consultant. And then another of our pediatricians, Dr. Webb, is also a certified lactation consultant. And then we have a nurse in the office who's also a certified lactation consultant. So lots of opportunities to find people who can answer any questions that you might have about breastfeeding.
Yeah, that's awesome. I know you think it's just a natural thing, but you actually do need a lot of support when you're going through it. It's not natural for the mom or the baby, and it takes a lot of practice and support.
Yeah, it's sort of a skill that disappeared from our culture, 50 or 100 years ago. And so everybody's learning again together kind of how to do this. And even if you're an experienced breastfeeding mom, sometimes you get a baby the baby is always a rookie at the beginning.
Mm-hmm.
And so sometimes you get somebody who just requires some special care and help at the beginning.
Yeah. Is there any advice you have for moms who are wondering about maybe if their supply is enough, if their baby's getting enough, if they're noticing any type of fussiness or, gassiness or different stools with their baby, what could be from their breast milk and what could need, I guess, more attention from a doctor?
Yeah. That's a huge question. That's like
lots of questions.
I'd say as far as is my baby getting enough, probably one of the keys there is really to make sure that you're doing the well child checks when we can sort of suggest them. So at least in our practice here, we really try to have people follow up with either the aftercare program, the lactation consultants on the floor, or in our office about 2 days or so after they leave the hospital, because that's usually about when milk is going to start to come in. And if you're going to hit a breastfeeding speed bump, that's probably where it's going to be. So we really like to have that visit a couple of days after you leave the hospital. Then in our practice, we usually have another visit about 2 days after that. So we get another weight check in that first week, and we really make sure that you're headed the way that we think you should be headed and that you're not kind of flattening out or continuing to lose weight. And it's really about kind of how we manage breastfeeding in that first couple of weeks that determines a lot of your long-term success. A large part of your milk supply is determined in that first 2 weeks. And so if we don't do a very good job managing your supply, then we can run into really big problems 2 and 4 and 6 months down the road. So those appointments are really key. And then your pediatrician will sort of give you a recommended schedule of when they think you should be coming in after that. Typically, we do more visits around the 2-week mark and then at the 1 and 2 month marks, just to make sure, again, that we're getting good weight gain for the baby. And the other side of it for the mom is that we want it to be a comfortable experience for her too, right? Mm-hmm. So I always tell people there should be 4 words that should describe your breastfeeding relationship. It should be pain-free weight gain. And weight gain is only half of the equation. So if the mom is experiencing pain or having difficulties, then we need to address that as well. And a lot of those, if we're going to have issues, we will uncover a lot of them in that first month or so. And that really is the best time to kind of intervene and make things better for everybody. Mm-hmm. So that would sort of be my advice on the weight gain part. Babies give a lot of cues too about when they're hungry and when they're full. And part of being a first-time mom or even a later-time mom is learning to read the cues in your baby so that you can understand where you are. And the lactation program or the pediatrician can kind of help you understand what those cues are. So that'd sort of be my quick advice on weight gain and milk supply and things like that. I think the gassiness and the fussiness is a whole nother huge topic. And I think today I've already had like 2 or 3 questions on this. So it comes up a lot for people, obviously. From a pediatrician's perspective, what I tell you is that fussiness is sort of a normal part of infant life, especially for the first 4 to 6 weeks. And really that peak in fussiness comes around the 6-week mark, and then things generally start to get better. Gassiness can also be a normal part of newborn life. As an adult, our intestine is populated by about 100 trillion bacteria on any given day. And when you start out as a baby, you have 0. So part of the first couple of weeks of life is really establishing those bacteria in your gut, what we'd call your microbiota. And until you get a good group of bacteria in there that help you digest food, you're probably going to be fairly gassy. And so part of it is just being patient and sort of waiting for that infant gut to continue to develop, and knowing that problem is eventually going to resolve itself. Sometimes we'll recommend that parents give babies probiotics. Those are little pills or powders that you can either put in a bottle, you can put in the palm of your hand and get your finger wet and then just sort of stick it in the baby's mouth so they can suck it off. Or some moms will even put it right on their nipple so the baby can get it while they're nursing. But the idea is there is the the probiotics are kind of like seed. So we're spreading the seeds for the bacteria that we want to grow there. And probiotics have been shown to reduce fussiness and to reduce gassiness for some babies. So it's definitely worth trying. I think a lot of times people will try things like gas drops and stuff like that. You're more than welcome to try those. The research around them says they're not super helpful, but on the other hand, I don't think they're super harmful. So it's worth a shot. And then sometimes people ask questions about, could it be a lip tie or a tongue tie? Those are good questions to talk about in the pediatric office or with the lactation consultant. It seems like those should be simple issues, but without getting into them in great detail, I'll tell you that they're not simple issues. They're actually really complicated. And then I think the other thing is sometimes people wonder, is there something in mom's diet that could be irritating the baby? And I have a story for that one. When I was a resident, I shared an office with a woman from India, and we both had kids that were almost exactly the same age, and we were both nursing. And the interesting thing was that everything that her mom told her to exclude from her diet for a fussy and gassy baby was everything in this country that we tell people to eat, and vice versa. So I think the short answer is we don't know if there are specific foods that really cause fussiness and gassiness in babies. There do appear to be a few things that sometimes are more common triggers than others, like cow's milk and soy. But for the vast majority of foods, there doesn't seem to be a clear relationship between gassiness and the food that moms eat. So I always kind of have people work with me if we're really going to do some experimentation there to see if there are some foods that might be triggering a reaction in baby.
Yeah. So I think some of the key points that I am hearing here is to communicate and work with your pediatrician, with your care provider, and look for like consistent weight gain with your baby.
Absolutely.
And I think maybe just relax and enjoy the enjoy the ride, and you're not doing everything wrong if you have a fussy baby.
Absolutely not. I think that's one of the hardest parts, is that we as grown-ups just want to fix it. And sometimes it's just neurologic immaturity in the baby and immaturity in their gut, and we just need to give them some time and let them work through it.
Yeah, that's really encouraging for moms for sure. Yeah. What would be a time when a mom would be able to decipher between when they can make an appointment with their pediatrician if they have a concern and maybe wait a few days to get on the schedule, or when they should just head to urgent care right away?
Yeah, those are great questions. In our office, we try really hard to keep some same-day spots open every day, so that we always have at least some access to the pediatricians here on a given day. So usually you can get in that day, or in the worst case scenario, maybe tomorrow. The other thing is that you can always call for telephone advice. A lot of times we can sort of tell you, oh, we really think that should be seen right now, and I'm sorry, we don't have any appointments available, or yes, we can get you in. So I think call, ask the question. If we really can't get you in, then we'll tell you that we think you should go to urgent care. But almost all things, it's really kind of preferable to come here or to whoever your primary care provider is, just so you get that consistent approach to your child's health and to your questions. That's not to say urgent care doctors don't do a great job. It's just, we'll know your baby since they were born. So
yeah, that's true.
Yeah.
It's that built relationship with your provider. Yeah, that's great. Awesome. Well, I think those are the last of the specific questions I have. Did you have any other information that you'd like to share, or anything important to bring up?
No, I think I just hit on maybe one of the small points that you already said, or maybe it's the biggest point, and that's really to try to just relax and enjoy the ride a little bit. There are definitely parts of having a newborn baby that are not relaxing, and it's also okay to sort of admit to yourself and to your partner that this is really hard work, and to just know that you're going to get through it. People have been doing this for a few million years, and mostly we all turn out mostly okay.
Mostly.
Don't worry about doing everything exactly right. I won't get into all the studies, but there have been some studies done that say exactly how good is good enough for a parent. And a lot of times people think, oh gosh, I've got to be on it like 70 or 80 or 90% of the time. The real answer from the studies is 30% of the time you have to be good enough. So I think that's a bar that we can we can hit comfortably.
I think so. For sure. Yeah. And you are available for questions for moms if they have any after watching this.
Absolutely. Yeah.
Okay, we'll have a link for Dr. Winesett for moms. If you have any questions, you can click there and ask her your specific questions. Otherwise, I will put the a phone number and a scheduling link in the copy of this video if you need to access it. Otherwise, thank you so much for being here with us today.
Great. Thanks for having me.
Thanks.
Everybody enjoy the spring sunshine.
Yes, it should be a beautiful weekend.
Yeah.
Thank you.
Thanks.